Hello Shade lovers, welcome to the continuation of the Ezetimibe together with the combination therapy. So in our first video, I've already given a breakdown of what Ezetimibe on its own does and its combination with these statins. Now let's go on to the combination therapy and what went into it. So I was on the SHARP, what we call the SHARP trials. With the SHARP trial, what they did in there was that they used one statin, which has got to the name of that statin is Simvastatin. Why? Because then the Simvastatin being used was as a result of the fact that it had an extensive safety profile data, and as on the other bit is got to do with the fact that the Simvastatin they knew about is what we call pharmacokinetics. Pharmacokinetics in medicine or in pharmacy basically is got to means how a drug, when it's taken, how it's being metabolized, how it's being broken down, how it's being distributed within the system, and how it's being excreted out of the system. So this bit of Simvastatin with the SHARP trial was well known, and that helped them, and that's why what they use. That doesn't mean that other statins cannot be used. The other statins, such as atorvastatin and ezetimibe combination, is really something that is very common now, as most guidelines or most prescribers used. Not that simvastatin is superior to atorvastatin or rosuvastatin, but with regards to this trial, that was what was used, and that's what's got the evidence, and that's why in kidney failing patients is normally used. However, combining the simvastatin and the ezetimibe in kidney failure is not something that's supposed to be started or initiated in dialysis or after dialysis if the patient was not already on them before their dialysis situation. So now let's go on to the combination. So once these statins or simvastatin is reducing the cholesterol by inhibiting cholesterol synthesis in the liver, whilst also the ezetimibe is also reducing cholesterol levels by inhibiting absorption from the small intestine. These together bring about a significant reduction in the levels of the bad cholesterol that could cause cardiovascular events such as heart attack or heart issues. I'm going to continue this in the next video. Thank you, Shady lovers.